often called VABs. My name is Monica Turner. I am the project coordinator for the Pathways to Oral Health Initiative, and I'll be serving as your facilitator today. We're so glad that you are here. For those of you that were with us last year for our webinars, welcome back. And if you're new here, thank you for joining. Our goal for the webinar is to share, or for the webinars is to share information about the Medicaid program. Is to share information about the Medicaid program and how everything works from enrollment and credentialing to filing claims and pretty much everything in between. The 6 webinars from last year are posted on our website at pathwaystooralhealth.org. There's some really great information there. So if you missed them last fall, you should definitely check them out. If there are topics about Medicaid or providing care for individuals with disabilities, you would like us to cover in future webinars, please put those suggestions in the chat throughout today's webinar, and we will do our very best to cover those topics in future webinars. But for today, and based on your suggestions, our goal for this session is to give you a clear overview of what value-added benefits are, why they matter, and how they may differ across Kansas Medicaid managed care organizations. We are so happy to have all 3 managed care organizations here with us today. But first, I want to thank the KDA for co-sponsoring this webinar. Also, the Pathways Initiative and this webinar is funded by the Kansas Department of Health and Environment Division of Healthcare Finance and an ARPA grant. Kevin, if you're out there, I want to turn it over to you if you want to introduce yourself and share any welcoming remarks.
Yeah, thanks, Monica. So I'm Kevin Robertson. I'm the Executive Director of the Kansas Dental Association. Well, I'm getting an echo. But anyway, I'll just keep talking. But certainly appreciate all of you being on the call. I know all of you have worked, or a lot of you have worked with Oral Health Kansas, KDA, and the Pathways program to get an increase in rates for Medicaid, and your input has been really valuable. And so thank you for all the hard work you've done and for the hard work being a Medicaid provider, because we know that there does come some obstacles with that. So again, thank you very much for being here, and I hope you learned something from the seminar.
On Friday?
It would be Saturday.
Oh, Saturday.
I am done.
Thank you, Kevin. Just a few quick housekeeping items before we begin. Please keep yourself muted if you are not speaking. Use the Q&A box or chat for questions or comments during the presentation, and we will try and save time at the end for questions and answers. If we're not able to get to every question, we can follow up afterward as needed. Please use the chat or email listed here to let us know if you're having any technical issues. There will be a total of 0.5 CEs available for participating today. Please put your name and email address in the chat if you require CEs. We will send those certificates out within a few weeks. And lastly, the recording and slides to this webinar will be available on our website. Just need to give us a little bit of time to get those uploaded. I want to just talk briefly about why we're all here. This webinar is part of the Oral Health Kansas Pathways to Oral Health Initiative, a multi-stakeholder project. This project focuses on 3 things: support for dental offices in being a successful Medicaid provider, education programs for dental professionals to increase confidence in caring for individuals with disabilities, and communication tools like the My Dental Care Passport, a tool we introduced last at one of our webinars last year, but please stay tuned for additional webinars on the passport. Like I mentioned, the Pathways Initiative is a multi-stakeholder project. This just is a reflection of all the partners involved in the efforts to make dental care more accessible and equitable for all. Each partner has played an important role in this project. We are ready to get going on our agenda this afternoon. We have a lot to get through in a short period of time. Marianne first will tell us about what a value-added benefit is and will provide us with a short history of the Medicaid adult dental program. Then we are super excited to have each of the managed care organizations talk about the specific VABs. As a side note, you will hear us refer to value-added benefits as VABs through the webinar. And with that, I'd like to introduce our Medicaid Projects Manager, Mary Ann Lynch Small.
Thanks, Monica. So as Monica was saying, it is a lot of information in a short amount of time, so whistle-stop tour here. But I'm going to set the scene, take a quick look back at the Medicaid dental program over the last decade. As I was saying, set the scene for today's topic of value-added benefits. So 13 years ago, managed care began in the Kansas Medicaid program. Then in Kansas, we have 3 managed care organizations. You might hear them be called MCOs, and we'll hear from all our current MCOs today. Federal Medicaid rules dictate that children must have dental coverage in Medicaid, but states decide that the adult coverage. So when managed care began back in 2013, there was very, very little dental coverage for adults in the Medicaid program in Kansas. It was essentially kind of emergency extractions. So the managed care organization stepped in and offered some basic adult dental coverage to their Medicaid members. However, if we fast forward then to 2022, we had that huge change. Oh, sorry, backside. There we go. That huge change in the Medicaid dental program with dental coverage being extended to adults. And then in 2023 and in 2024, we had further services added. So a huge change in what is covered for dental in the Medicaid program. You might notice here on this little timeline that in 2024, we had some of these kind of standard bread and butter services like exams, x-rays, and cleanings added to the Medicaid's dental coverage. This is all related to value-added benefits, and so we'll get back to that in a second. And then, as Kevin touched on in his welcome, the past 2 years have been focused on increasing the Medicaid reimbursement rates. And next slide, please. So we keep talking about value-added benefits, but what are these VABs? So these are additional services or benefits offered to a Medicaid member by their managed care organization, which goes beyond the standard Medicaid coverage. So these value-added benefits are not part of the state Medicaid benefit package. And these benefits can be additional healthcare services and things like assistance to support healthy behaviours, like ways to increase access to fresh food produce, some more support with communication, and more. And next slide, please. And as I kind of alluded to, VABs have played a role in Medicaid dental here in Kansas. So if we quickly revisit that timeline, as we touched on back in 2023, before dental services were extended to adults in the Kansas Medicaid program, the MCOs offered some dental coverage for adults, like exams, cleanings, and there were services up to a maximum dollar amount allowed, and this coverage fell under these value-added benefits. Then after dental coverage was added in 2022 for adults, we heard from some providers that there was some confusion out there as to, okay, what dental services were covered and what services were covered and by who. So why were exams and cleanings offered by the MCOs and not part of the standard state Medicaid benefit, for example? So in 2024, these core services previously offered as value-added benefits were added to the Medicaid benefit as standard coverage. This was exciting because it meant in 2025 and 2026, the MCOs could elect to offer new value-added benefits related to dental, and I won't steal their thunder. They'll touch on these in a second. And next slide, please. So each MCO offers a different set of value-added benefits, dental included, and dental services rather included. And you will hear more about what each of these MCOs offers shortly. But you can find a comprehensive overview of all the VABs offered to members of each MCO on the CanCare website. There's a link here, and as Monica said, you will have access to these slides. So yes, there's value-added benefits that are directly related to dental, but there's value-added benefits that cover kind of different services and additions across the board. And next slide. And then just a little reminder before we pass over to them. In Kansas, there's the three MCOs, and currently there are Healthy Blue, Sunflower Health Plan, and United Healthcare Community Plan. And I'll pass it back to Monica and we'll hear from each of them.
Thank you, Marianne, for that informative overview of the history of CanCare VABs. Next up, we have Josh Vargo, a program manager of workforce development with Sunflower Health Plan. He's going to tell us about Sunflower's VABs. Josh?
Yes, good afternoon, everybody, and thanks for having us. So I'm going to give you a little insight of just some of the value-added benefits that Sunflower offers. We offer a wide variety of these, and they are some of them have eligibility requirements. There's such things as ages, waiver programs that people will need to be on to get some of these benefits. So they're not always open to everybody, but we do have quite a variety for everyone. The first one is the My Healthy Rewards, which this is a way for members to participate in their health care and get paid. We put money on a card that they can use these cards for things like utilities, phone services, groceries. You can use it at Walmart. And the way these members can get this money, simple things like completing their healthcare forms, lead testing, registering for our portal, annual visits, those types of things can earn cash to go onto their cards and can be used for their benefit. Next slide, please. We also offer transportation benefits. So these are enhanced transportation benefits, excuse me, for our members that can be up to 12 rides per year. These are additional benefits that can get you to places for getting food, to housing, to your employment services, visits to pharmacy. So we add up to 12 of those a year. Next slide, please. Farmers markets, another big one, where we try and go to local farmers markets throughout the state. Our members in those areas will get mailed a flyer. They can get $10 for food vouchers for anything good at the farmers market for fresh produce for those families. And it's per member, not just per family or household. So if you have 6 members, households can get $60 in credits. Next slide. Thank you. We have also our cell phone service where members can get free cell phones. So they can do that through SafeLink. Next slide, please. Sorry, I'm trying to move pretty quick and keep time here. We also have youth programs. So our Sunny Kids Club, which promotes healthy eating and exercises. They get fun books mailed to them. There's also $50 credit per year for places like the YMCA, Boys and Girls Clubs, Girl Scouts to help get those youths out into the community. We also partner with the Strong Youth Committee for Pro Football Hall of Fame. Sorry, we can go to the next slide. Oh, sorry, that one's in there twice, it looks like. Next slide. We also have employment support services to get those people to ride opportunities for work programs, GED testing. We just try and benefit with getting people into the community and getting them that work exposure that they need and helping them along the way. And next slide. Here's just a slide of some more of these extra benefits. And really the only dental part that we would have for our members is for those IDD waiver members that are on the wait list, where they can have 2 practice dental visits to where they can go to the provider's office, see what it looks like to be in that dental chair, and then go through that process with no care given, but the dentist can still get paid for that. So that's kind of one of those new things that we've added. That's basically what we have for the dental side alone. I think that's kind of a quick touch base on what we have, but that chart that we gave the link to earlier will give all our added benefits to everybody.
Thank you, Josh, so much for sharing Sunflower Health Plan's value-added benefits. We appreciate you being here today.
Thank you.
Next up, we've got SkyGen's Provider Field Relations Manager, Dion Haney. She is going to tell us about Healthy Blue Kansas VAB. Dion?
Thank you, Monica. Hello, everyone. Like Monica said, my name is Dion Haney. I am the manager of the field relations team here at SkyGen. SkyGen is the dental administrator for Healthy Blue Kansas. We could go through a couple slides here. So today I'm going to share with you specifically the value added benefits on the dental side of Healthy Blue. So starting January 1st of this year, we did add the value added benefits for adults 21 and over, those that are on Medicaid only. We did not facilitate this for the children because children can be covered under EPSDT. The VAB benefit for Healthy Blue members is a $500 annual maximum benefit. It can be applied to any dental code not currently covered by the member's Medicaid benefit. And this would exclude cosmetic services. Just a quick note, the value added benefits do not count towards Spendone as they have their own benefit max. The benefit's going to apply to various codes, and all of these codes can be found through the benefit grids that are available on the Dental Hub. There is a link here to get to the Dental Hub. I believe most, if not all, providers that are submitting claims through SkyGen for Healthy Blue are using the Dental Hub. But once you log into the Dental Hub, you'll just go to the main menu, click on Practice Management, go to the Documents, the Payer Documents, and it will produce the different benefit grids. And then on the far right-hand side, it will tell you if it's a value-based benefit. While we were preparing for this particular presentation, I was asked about the Healthy Blue Sensory Dental Kit. Members on the IDD waiver with sensory or dental anxiety can receive one of these kits per year. This kit can be found and ordered by the member's online portal or through the Sydney Health app. But if you have any additional questions with regards to the value added benefits, you can reach us by contacting the provider services phone line, email. There's the Dental Hub app URL again, along with Dental Hub support if you're having some technical issues with the Dental Hub. And then my contact information is there, along with the provider field relations representative, Billie Jean Hubbard. So again, thank you everyone for inviting us today and look forward to hearing from you.
Thank you so much, Dion. And last, we have Monica Hopkins, Provider Relations Advocate from United Healthcare. Monica?
Hello, Monica. Thank you. Thank you for the opportunity to share today. So I will be presenting for UHC. I'll provide just a brief overview like the others did for the dental value added benefit and clarify how it applies in practice, along with how services differ for adult and pediatric members. Next slide, please. So on this next slide here, it shows that UHC has additional $500 for specialty dental services that are not covered under KenCare. A common myth is that the $500 represents a maximum dental benefit for our adult members. The reality is that it is an additional value added benefit specifically intended to support services that are not otherwise covered for members ages 21 and older. So, from a billing perspective, the process is pretty straightforward. Providers should submit claims using the procedure codes identified in the dental provider manual. I did include those links here. So, as shown here in the manual, they will have an asterisk beside the code for easy identification. When those codes are billed, the $500 annual allowance is applied automatically. Providers and members can also contact United Healthcare Community Plan to confirm how much of that $500 has been used before those services are rendered. And then it's also just important to note, so if there are services that are not covered that exceed that $500 annual allowance, the remaining balance would become the member's responsibility. And of course, you'd have to do the financial responsibility form if applicable. So in short, this benefit is designed to expand access and not limit it by providing additional coverage beyond what is already covered. Next slide, please. So we do have 3 fantastic provider relation advocates here. If you have any additional questions on your value added benefits for the members, we have Kathy Smith, Jennifer Martinez, and Casey Burse, and their contact information is there. Next slide, please. And then on this slide, we will also just give you to show you where that they are working in what location and who your provider rep would be. So there's for that slide. And then for the last slide, I believe that I just want to shift gears for a minute to the pediatric members. Children are not eligible for the adult dental VAB. However, they do have access to services through EPSDT, and that is the Early and Periodic Screening, Diagnosis, and Treatment Program. So under EPSDT, when a service is determined to be medically necessary, it may be covered even if it is not typically included under the standard dental benefit, and that also sometimes includes exceeding those benefits if it's medically necessary. So for providers, this means when submitting an authorization, supporting documentation demonstrating that medical necessity is key. If approved, that service can be covered through EPSDT program. So while the mechanism differs from the adult VAB, there is still a pathway to access additional medically necessary services for children. So when using the ADA dental claim form, there is a box that can be checked for claim adjusters to identify the claim is being submitted for that EPSDT. And I just wanted to include our children here. But in summary, for adults, the $500 value added benefit provides additional support for non-covered dental services. For children, medically necessary services can be accessed through EPSDT. Thank you so much for your time today.
Thank you, Monica. I appreciate that. Thank you to all of you. This was a great information. Today was a great chance for offices to understand what is available through each managed care organization and help you all connect your patients to resources that support better oral health and improve their ability to receive the care that they need. We do have some time for questions. If there were any questions in the chat, Tanya, I don't know if anything came up, but feel free to come off mute and ask any questions that you might have.
There are not questions in the chat just yet, so yeah, come off mute, please, and ask any questions. It's a great opportunity here. I do think everything was explained well. Maybe that was true.
Absolutely. I thought it was a great overview of which each managed care organization provides as additional benefits beyond the just regular benefit.
Monica, there's a logistical question. Will the recording be sent out, or are we able to access it for reference?
The recording, we can email those to registrants as well as being posted on our website. That does take a little bit of time and editing, So just be patient with us. We will get those out hopefully within the next couple of weeks and posted to the website. There's a section on our pathways to oralhealth.org website that is full of great resources for providers and all our past webinars, and that is where those will be located. If there are no questions, I am going to move on. Still feel free to ask any questions in the chat, but I am going to move on. As we conclude this webinar, I want to remind you that the 0.5 CEs will be provided for this webinar. If you have not done so already, please place your name and email in the chat. We'll be sending out certificates in the next couple weeks. And just remind you all of a few resources, like I just mentioned. The pathways to oralhealth.org is loaded with Medicaid provider or provider guidance documents for troubleshooting. All of these can be found on our website at pathways to oralhealth.org. And other resources regarding Medicaid adult dental benefits and covered codes can be found at oralhealthkansas.org. And just remember, we also love to hear from you. If you're interested in signing up for our dental provider advisory group, you can do so here with that QR code. Or for our weekly Wednesday updates, just our newsletter with up-to-date information on things that are happening around Kansas and nationally in the oral health space. And as always, we're here to help if you need help getting enrolled and becoming a Medicaid provider, or you are a provider and are having issues that require some troubleshooting. Please contact us at info@oralhealth.org. We don't always have the answers right away, but we will do our best to find the answer or connect you to those who do. And then lastly, thank you so much for joining us today. Please save the date for Other webinars in the series, August 11th, and then also October 13th. We will be periodically coming out with a webinar, so just look for that information on social media, in our weekly Wednesday updates, and anywhere else you might be able to find your oral health information. We'll try to get it posted there. But thank you so much to our MCOs and everybody for joining us today to learn more about value-added benefits. See you later.